Hello, Internet. Checking in with you guys. You won't believe what just happened. I had already gotten 5 or 6 minutes into a video where I was really sharing what was going on. I felt like it was going really well. All of a sudden, the doorbell starts ringing and someone starts banging on the door. And, it just totally shook me up. And it's 6:30 in the evening. I don't know who that was, but anyway, the point is I couldn't go on with the video. And honestly, I haven't figured out how to do edits. I guess I could, but I haven't gotten to that point where I can stop a video and then start it up again and edit that out. I haven't gotten that far. So I'm starting all over again. There's Ginger. See her? She's 16 years old and she's being very patient. She's had her dinner. So, anyway, what I wanted to let you guys know is because of my last video, I alluded to the fact that we were in the middle of decision making. I did want to let you know that we decided to take a break. That was a unanimous consensus among my Mayo oncology team, my local Minnesota oncology people here in the Twin Cities area, and then also myself, obviously, and my family members. It just kind of came together after all the meetings that have happened in the last 2-3 weeks. And it became very clear that it's time for me to take a break. The scans that I had at the end of April, which I've already talked about, showed that my disease is under control as far as we know right now. And so again, we've had a successful round of treatment these last 6 or 7 cycles. And with summer coming on and the fact that I'm still dealing with side effects, I don't know if you can see my scalp. I still have scabs on my scalp, which are peeling off all the time and leaving bloody spots on my pillow. That's still ongoing. Check this out. My arms. It's funny, the last round it was my legs, like my thighs, and this time it's my arms, and it's always been my chest and shoulders. But anyway, I'm still having the skin conditions because the half-life of panitumumab, which is my targeted therapy, which is an epidural growth factor receptor inhibitor, that panitumumab targets the skin. It targets those cells and obliterates them, which is great, the cancer cells, but then it also affects my regular skin, and especially scalp, hair follicles, the bottoms of my feet, the tips of my fingers, which has been much better this year than last year, as I've mentioned a few times. So this round of chemo was much less intense on my fingertips than last year, and I've been able to do better. Exactly. I went back and looked at my journals from exactly 1 year ago, the middle of May, and I was barely able to type. I always journal on my laptop, and I had 1 or 2 paragraphs, and that was it, because I would be complaining about how hard it was to type. So the point being, the fingertip issues have not been as bad this time around as they have been in the past. So we decided to lay off the treatment. My next round of scans is going to be the 31st of July. And of course, that will come with all the blood work as well. And in between now and then, I will also be meeting with my local oncology team, and we'll do blood work and the CEA, the carcinoembryonic antigen, which is the main tumor marker for colorectal cancer. And as you've heard me say, my number has been in a pretty good range recently, almost a normal range around, I think right now it's around 0.8 or 0.9. And for some perspective, when I first got diagnosed, it was 153. So, in other words, biochemically, and as far as the things that we can monitor and see, I'm doing pretty well. My doctor My oncologist down at Mayo, even in her clinical notes, she talked about chronic indolent disease. You know what chronic means? That just means it's kind of ongoing and it comes back. But indolent means lazy and non-aggressive and very slow moving. So that's the good news, is that at least as of right this minute, from what we know and what we can see and what we can observe and measure, my disease is lazy, indolent. It's there, and it probably always will be there. I mean, I know there's some of you guys who are out there, and I appreciate it so much. You're telling me you're going to be healed, you're going to be cancer-free, you are going to be 100% cleansed of this disease. And of course, I want to believe for that, and that's possible. God can do anything he wants. But I also am kind of a scientific guy, and I know the stats, and I think I'm going to be fighting this, you know. But hey, what if there is a miraculous cure that comes along? So thank you guys that are thinking that way, sending vibes my way, praying for me in that regard. I appreciate it so much. So, okay, there's Kitty Cat. I'm at my brother and sister-in-law's house, and we have Ginger, the 16-year-old dog who was sitting over here, and then we have Rue, the kitty cat, which she actually belongs to my niece, who lives in Austin, Texas right now. So she hangs out here. Okay, this truly is a shorter video, and I'm gonna get this posted because I wanted you guys to know that we did make the decision to pause treatment. We're on a holiday at least until the end of July, and most likely beyond that. That's the way it looks right now, and I am happy for that. It will give me time to sort of recover from all these side effects. So anyway, all the best to you guys, and thank you again for being here. It means a lot.